My name is Dr. Mazie Tsang. I am an assistant professor at Mayo Clinic, Arizona. In addition to being a hematologist oncologist, I am a board certified palliative care physician. And today I'm here to talk about why palliative care may be introduced as part of your oncologic care. So first, I'd like to discuss what is palliative care. Now, palliative care is a specialty for patients who are at all stages of any serious illness. And as you can see in this figure, palliative care focuses primarily on quality of life and can complement any sort of life-prolonging care a patient might be receiving. Now, this is distinctly different from hospice because I know sometimes palliative care and hospice can be confused with one another. And so I'm here to talk about the differences and talk about how palliative care is integrated into cancer care. Now, who provides palliative care? Palliative care incorporates interdisciplinary team members. So it includes physicians, nurses, social workers, chaplains, and depending on your team and institution, there may be massage therapists, music, or art therapists as well. Now, in the ASCO 2018 guidelines, so ASCO is the American Society of Clinical Oncology, they recommend considering a palliative care referral for hospitalized patients with any solid tumor malignancy. So the people in particular who may benefit from palliative care referral would be someone who's diagnosed with an advanced cancer, anyone who had a prior hospitalization within the last 30 days, anyone who's had hospitalizations lasting longer than 7 days, or has active symptoms. So that can include shortness of breath, significant pain, any sort of nausea or vomiting from treatment or the cancer, as well as any other symptoms that may arise because of your cancer or chronic illness. Now, is palliative care right for you? Palliative care is a service that can help improve your ability to go through medical treatments. So if you feel that you may benefit from an extra layer of support to get you through the medical treatments and any of the side effects, you may consider palliative care. Palliative care can also help you better understand your medical condition and what that can mean in the bigger scheme of your lifetime and how this can impact other parts of your life. And palliative care can also help you understand your choices for medical care. So the palliative care team, they have different skills in communication that can help you understand your choices in the greater context of how it could impact your family, your other medical conditions, your overall quality of life, and what it could mean for you long term and how it could impact you down the road. So, if you want medical care that can help support you for symptoms that are not well controlled, that could help assist you if you're feeling overwhelmed, or that could be an extra layer of support for decision making and for your family, then palliative care would be right for you. This is a beautiful study from the New England Journal of Medicine in 2011 that showed that there was better survival for people with metastatic, so stage 4 non-small cell lung cancer who received early palliative care within the first 8 weeks of their diagnosis. So as you can see, what this line here in the early palliative care group is closer to the number 1, which indicates that 100% of people survived at these different time points. And so the fact that this is a higher line than the standard of care means that more people survived at these time points at 20, 30 months compared to standard of care. And so this really changed the landscape of how we viewed palliative care as part of oncologic care. And this type of benefit is something that would be seen in an FDA approved drug. And so palliative care really can change the outcome for people with cancer. Now, what we need to also consider is that when we address the needs of those who are seriously ill, we think about how patient needs can intensify as people have their cancer continue to grow, or as their cancer course continues to progress. And so with time, we see that this intensity will change. And at the base of everything, we think about advanced care planning. So at all stages, we as an oncology care team want to know what is important to patients. How do they think about their care? Who do they want to make decisions for them? And the oncology care team can provide what we call primary palliative care, meaning they can be the ones who will initially manage all your symptoms, who can help you with decision making, who can address your concerns and enhance your quality of life. But as the needs intensify with time, you may need what we call consultative palliative care, meaning people who are board certified in palliative care, who specialize in this, and their clinical team to be able to provide you an even higher level of palliative care specialty and specialized care. And so with consultative palliative care, that really helps with people who have very intense needs and symptoms. And that can occur with time. Eventually, with time, if people's cancer reaches a point where it no longer responds to treatment, then at that time, palliative care could be considered to be delivered at home. And depending on someone's values and whether they wanted to shift solely to a comfort-focused care, they could consider end-of-life care with hospice.